So I spot etch, I apply the desensitizing agent, I seat the splinted provisional veneer, I remove the excess cement, and then I spot tack the provisional in the mid-facial. I remove the gingival margin cement and I spot tack the gingival margin. And that was a quick trailer that I created for a video that I just have been working on today, this afternoon. It's not that long a video, it's about 8 minutes long, but it shows the exact products, sequence, and technique that I use to create provisional veneers for my patients. And provisional veneers are restorations in my practice that I need to have in place for anywhere from 4 to 12 weeks, depending on the case, sometimes even more than 12 weeks. So I need a reliable technique. And if you're not sure about your veneer provisional technique, or you're having trouble with your provisional veneer technique, or you don't treat as many cases with veneers because you don't like your current provisional veneer technique, I think you'll want to watch this new video that I created. And what my plan is, I'm going to send this new video to everybody that registers for my new free training webinar. This webinar is called The 6 Pillars for Treating the Complex Wear Patient. The 6 Pillars for Treating the Complex Wear Patient. And it's going to be presented live on Thursday, May 26th at 8 p.m. So if you want to learn, first of all, my veneer provisional technique, and then you'd like to see a complex wear patient case study from start to finish, showing you what I think are the 6 pillars for treating these cases, and you'd like to see this case, this is the case that I'm going to share with you during the case study webinar, then register for my new webinar. There'd be a link below this video. And I think that you'll really enjoy this free training. Now, if you can't come to the live event on Thursday night, that's Toronto time zone, by the way, Eastern Daylight Time. If you can't attend the live event on Saturday, the 28th, we're going to be sending out invitations for an encore presentation that will have a few different start times. So you'll have the option of watching the encore presentation, and it should have a start time that will be convenient for you wherever you live in the world, because I'm gonna run it a few times. I'm gonna present it a few times. So even if Thursday night does not work for you, make sure you register, because we're gonna send you that video that shares with you my technique for provisional veneers, which I used for this case. That video was filmed in my Zeiss microscope from this particular case. And then we'll also send you the invitation for the actual clinical training webinar. Here's a few more images of this case, before and after images, but the webinar is going to go into a lot of detail, like you just saw in that quick trailer video, showing you technique. It's not going to be before and after pictures, it's focused on technique, but I just want to show you the results that we can achieve with the techniques that you're going to learn. And these are the 2-year post-treatment photos for this particular case. Excellent clinical result. And again, it's going to be a technique-oriented webinar, so you'll learn some valuable techniques that you can use in the wear patients in your practice, in the severe type of wear patients that you have in your practice, because everybody has wear patients in their practice. It's just part of being a clinical dental practice. You'll have some patients with tooth wear. So once again, join me on Thursday, May 26th at 8 p.m. If you can't attend that particular live webinar, we'll send you an invitation on the Saturday, the 28th, for an encore presentation, because this will be available for a short period of time at a few different alternative times that should fit within your schedule. So once again, thank you for joining me for this quick video. You'll get lots of detail on the clinical veneer provisional technique in the video that I'm going to share with you the day before, on Wednesday the 25th, or if you sign up after Wednesday, like Thursday morning, we'll send it to you right away so you can watch it before the webinar. So thanks once again, and we'll talk to you soon. I'll connect with you on the webinar. Thank you. Take care.